Hi there, YouTube community. It's Hannah. Today I want to talk about routine male circumcision. No big deal, just a nice, casual, friendly discussion about chopping parts off babies. This has been, in my personal experience, the most triggering and challenging topic amongst my actual real life friends. And it's something that nobody seems to want to talk about or think about, but that we keep doing to little baby boys. And so it's a bit of a tough cold open for me. You know, like, what are you going to say? Like, for hundreds of thousands of years, like, men's dicks works just fine. And like, one day we decided to do a thing. So I've decided, I want to open and I want to close with just a personal anecdote, because the only thing that I can speak to in this whole world with authority is my own experience. So, and possibly, it is a bit of a charged subject matter. So if we can all have a laugh at my expense, that's pretty good, myself included. So I grew up in an area of the country. I'm American. But I grew up in an area where circumcision just wasn't a thing at all. That's not a thing culturally. I grew up on the Navajo reservation, okay? So not a thing. Secondly, I grew up in a family that it also wasn't a thing. Not even on the table for discussion. And those things are kind of like, interestingly, totally unrelated to each other, because my family were like Caucasian AF, like we're not Navajo. It just so happened after the earlier part of my life, we were literally a transient family. Like, we were literally transient, living in all kinds of different confabulations, with and without utilities, with and without running water. And ended up, my dad was in the oil field, ended up on the Navajo reservation. When the oil field went bust, he went back into school teaching. And so there we were. So I was like 9 when we moved there. I, came of age, became an adult, blah, 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 and then also a third point that I think is important is this was all absolutely pre-internet. So I'm 49, I'm almost 50. So it was a long time more in my life before anything about the internet happened, which for the younger folks here, you just can't imagine how hard it was to just know anything. And I don't even mean like knowing facts, but just like knowing what kinds of discussions people are out there having at all. You just didn't know that stuff, I mean, like the kind of intel I was getting from growing up on the reservation was like, one day everybody got rid of their Garth Brooks t-shirts, and I was like, what's going on? And he said something about drunk Indians in an interview, and I was like, oh, okay. Like, it was hard to know things, okay? It was difficult to know what even like a level of dialogue was. So Navajo reservation, no circumcision concept whatsoever, not a cultural thing. In my family, also not a cultural thing. Like, there's 2 of us. So my older brother was born at home with a midwife, and my parents were absolutely like not about to be messing with us. My parents were, I think, really ahead of their time. He was born in New Mexico. I was born in a hospital in Wyoming because there just weren't midwives there or whatever. So with my brother, my parents were like, yeah, like there's not going to be any freaking surgical interventions on our perfectly healthy baby boy, right? For me, I was born in a hospital. Doctor wasn't even there when I was born, but I was born with a birthmark, and the doctor suggested it was on my left cheek, and the doctor was like, hey, she's a girl, want her to be pretty, right? You want me to just like slice that off? My parents were like, don't fucking touch our baby, right? And I went on to grow up and have like quite an unsightly birthmark on my face, which would have been one thing if we just lived in the same town all the time. But like I said, we were pretty transient. It was like new kids at school, new kids at school, new kids at school. Like, we moved all the time, and I was constantly getting like hazed and teased about this like ugly thing on my face. So I prevailed upon my parents finally to get that actually chopped off when I was in like 4th grade, and I still have a little bit of a scar there. But I only say that to illustrate the extent to which my parents were like, do not fuck with our babies. It was not even on the table. So like I said, I came of age. My first two boyfriends were Navajo guys. And I would say the first one was kind of like a situationship that went a couple years, and we didn't really have the terminology for that then, but I was like, what's happening, you know? The second boyfriend that I had we were together for 6 years, you know, which is kind of a long time when you're really young, especially, you know. Like I said, circumcision completely wasn't a thing in my family. Completely wasn't a thing. I had no concept for it whatsoever. Like, it would never have even occurred to me that this was a thing, right? Okay. So then I found myself in my, you know, mid-20s, like post that relationship, in college, in a situation with a guy. Let me just kind of speed run through this. Okay, so he was like a waiter at Perkins or where I went to study or something like that. Probably like things came to a head. We're making out. It's dark. I like reach for his dick, right, in the dark. And my hand encountered something so foreign to me that I recoiled, and I didn't know what to make of it. I was so confused, and just like, to just completely decode this and not make it too long. The guy was circumcised. Okay, he was a white guy. He was circumcised. Second of all, he had a Prince Albert piercing. Third of all, and I think this is probably the most important thing, is that I had no concept whatsoever that either of those two alterations were even a thing or possible or thought of or existed anywhere on the earth. Like, none. So in the dark, I like, as one does, you know, that's how it happens. I reached and I recoiled. I was like, what did I just touch there? What was that? What was happening? It was almost like, I mean, if you have a frame of reference for like something might be like this or something like might be like that, that's different. That's different. But it's almost like that kind of shock if you think you're reaching for something hot but it's cold, or you think you're drinking iced tea but it turns out to be apple juice, or like, you know what I'm saying? Like total like sensory disorientation. Like that's what happened to me. So long story short, lights got turned on. And I think this guy was he was kind of proud of the shock value of his Prince Albert. I mean, one does not just simply like do that by accident. Like, he clearly got this going on purpose, and he was kind of like, yeah, check out my Prince Albert. I mean, if anyone out there has a Prince Albert, hopefully that's gone by the wayside, but this was the 90s, right? First of all, I feel like you should maybe give a little bit of fair warning, but you know, okay, whatever. So he thought that I was reacting to that. I cannot emphasize enough for you that in this conversation that he and I like proceeded to have, that we weren't like, we didn't understand what each other were speaking to. So he was like, yeah, check out my Prince Albert. And I was like, okay, like I understood piercings, but I was like, where's the rest of your dick? I mean, I know that we're all sensitive about our stuff. I would never want to say anything mean. So I was like really struggling to articulate my feelings in this situation. But I was like, okay, I can see you have a piercing, but like what? I had no frame of reference whatsoever for circumcision. So I was like, where's the rest of your dick, essentially? And he was like, what the fuck are you talking about? And I was like, I had to question I was like, the whole rest of it. And eventually he got he finally clued into the fact that he was like, oh, like I'm circumcised? And I was like, I guess? And he was like, well, everybody's circumcised. And I was like, no, they aren't. I mean, I didn't have like a lot of experience, but I had some experience. And again, pre-internet, it never even dawned on me that like men of this area where I grew up that are a different like culture and race might be, why would I know that, you know? So he was like, well, yeah, everybody's circumcised. And of course he himself has no experience personally with like not being circumcised, because they do that to you like several days after birth, right? So I was like, no, that's that's not a thing. Not everybody's circumcised. And he was like, yeah, everybody's circumcised. I was like, no. So we got into this like really confusing, and again, not trying to like hurt feelings or anything. Ultimately, I ended up feeling like the vibes were off, you know, and realizing that I just wanted to go home or something like that. So that's how I learned that circumcisions even exist and are a thing. So I feel like I entered this whole sphere kind of coming, as have happened with many other areas of my life. Like, I feel like God made me backwards or put me into my experiences or preferences backwards or something like that. But my frame of reference was the other. And the other works just great, you know, works just great. I was in a 6-year-long relationship with a guy. So then, you know, when I got older and I start to realize that apparently this is like a thing that in my mind, I mean, I didn't really understand at the time, but like white guys do. I was like, okay, so this is like what white guys are doing. I was like, well, why? Because there's many reasons to recommend the contrary, which I'll go into. But like those reasons were kind of like flippantly given to me by different people. And I was like, that's not true. That's not true. I don't talk with my brother about his dick stuff, you know, that would be weird. But like, I feel like my entire lifetime, like growing up, like there's two of us, there's me and there's my brother. I feel like if there was like some massive catastrophic, like schmegma avalanche situation, like I would have heard about it or something, you know? So those just like didn't hit with me. And then also, again, I was in a 6-year-long relationship plus a formerly couple-year-long situationship or whatever with another guy. And I was like, I don't understand why people are saying these reasons and these rationalizations for circumcision when they're just not true in my experience. I can't connect that to anything in my experience, you know? So there's my personal anecdote. All right. So I guess, you know, maybe the burning question for some people is like, regardless of the downstream effects for men, which I'm totally going to get into, and how we're culturally framing it, and, you know, the fact that like pretty much 2/3 of the men on this earth are not circumcised and they're fine, and all of humanity was not circumcised for most of our existence here, and it was fine. Like what is a woman's take on this, you know, because men's issues become women's issues real quick when you start cutting off parts of guys' dicks, right? So I feel like I'm getting into like tough terrain here. Okay, I'm gonna do the best job I can. So if I had a choice, this is not the closest alligator to the boat. Okay, I gotta say that. This is not the closest alligator to the boat. All other things notwithstanding, there's a whole lot of we're really choosy, right? We're really choosy. But you know, I have the option going forward, ideally speaking, some kind of hypothetical situation, and he's a circumcised male or he's an uncircumcised male. Like, having had a lot of women that I know, I don't know that many women that we talk about this stuff, but like some female friends that I have, they've never slept with a guy who's uncircumcised, so they cannot have an opinion about this. A couple of girlfriends that I have, myself included, we do have the contrast, and we would prefer an uncircumcised male. Okay, so, but please do not feel badly about yourself or your setup or whatever as a result of this. Like, basically, like, we're just happy. Think of us as pedestrians. We're on foot, okay? And it's almost like the offer between an amazing Clydesdale or an amazing Pegasus. Like, okay, all other things equal, I'd probably pick the Pegasus because it has wings and can fly, but I fucking wouldn't turn my nose down at a Clydesdale. It's all fine, you know? And really just, you know, just like some like rigidity and like being a good person, like, you know, there's just a lot of stuff that's more important. So this is not to make anyone feel bad about their setup. But the reason that we feel this way, those of us who have like, you know, had the opportunity to contrast and compare, is that the mechanical motion that results in orgasm for men is pretty much different from the mechanical motion that results in orgasm for women, because we, you know, it's all like a hub of nerve endings around our clitoris, and we have a hood. They didn't cut our clitoral hood off, which is what they did with your fucking foreskin. When they cut the foreskin off, they didn't just cut off like some like useless, like insensate flap of skin. That shit contains like 20,000 nerve endings and represents like an elemental, like sensual, tactile apparatus to the whole thing that also protects the rest of it and the glands and the head of the penis and stuff from being desensitized. So there's still countries in the world where they practice clitoridectomy. And if you have like a super, super sensitive thing, like let's say the clitoris, and then for incredible biological reasons, there's like a hood that covers that, and it's only gonna sort of like, when it's like really stimulated and engorged and like feeling really good, it's gonna sort of like come out from that, you know. If you don't have that protective hood, then the thing is gonna become desensitized necessarily, so that then it's more difficult to sensitize it and it requires more stimulation, right? So clitorises in women who have not been subjected to absolute quackery and fucking barbarism and savagery, you know, because we didn't get our shit cut off when we were born or when we're kids, have very sensitive clitorises because there's a hood that protects it, which is the same thing that the foreskin does for the penis, okay? And when a man's dick is like engorged and like all feeling good and everything, then, you know, right? And the foreskin provides some natural lubrication. Without that, the lubrication has to be exogenous, you know, it has to come from the woman, or it has to come from like KY or something. Like, all this stuff can be worked around. It's not a problem. Two people like each other, you know, work that shit out. You know, it's not a problem, but it's just like, it's really helpful. It's really helpful to have a foreskin, because the foreskin, when it's like pushed back and the dick comes out, and there's like one mechanical motion that works for the man and like kind of like a different, it's so close. Oh my God, it's so close. It's just not right in the same area, but it's so close. The foreskin kind of like bridges that gap. Do you know what I'm saying? Where the penetrative intercourse that feels good for the man is like more likely to make contact and feel good for the woman with our like entire like hub, you know, of nerve endings that go all the way into our vagina and everything, you know, it's like all over everywhere, which we are the beneficiaries of because we weren't, you know, subjected to quackery, you know, I mean, women are in other parts of the world, that sensitivity, you know, because we have something there to protect the sensitivity. So there's a lot of erogenous zone, and the protection of other erogenous zones that gets removed for males with the removal of the foreskin. And that same like tissue that represents the foreskin is very like positive for women in terms of like mechanical intercourse, right? So when I say that I'd be stoked to have, I'm on foot, I'd be stoked to have a Clydesdale, I might prefer to have a Pegasus because I can fly with a Pegasus, like that's what I'm talking about. Sorry to make it so crude, but you know, so routine male circumcision remains in the United States, certainly, and other parts of the world, a dominant ideology in the sense that it's not, it just kind of perpetuates, not as a result of really being able to withstand any healthy level of like inquiry or skepticism. It's just kind of the thing. People just do it. You know, there's all kinds of most of the reasons that are offered are the same reasons that in the Sudan are offered to perform clitoridectomies on women. And for some reason over here in the US, we've all been able to track on the fact that that's not, like that's not good enough, you know? And I think that arriving here in 2025, that's when I'm filming this, where we're at in the sort of like rise and hopefully collapse of the trans agenda. If any populace is well positioned to ask meaningful questions about the real value of conducting irreversible genital surgeries on minors, I think we're a populace that's well positioned to ask those questions, and I think we should, you know? So, okay, I wanted to kind of get based on my little anecdote that I've told you, like that maybe we should just like not do that. That wasn't a tough sell for me. It was honestly kind of shocking for me that everybody everywhere is just kind of by rote, you know, just kind of like perpetuating, you know, well, I don't want him to get teased in the locker room. I don't want him to get yeast infections. I don't want him to get HIV, you know. Circumcision has been advanced as a way to avoid HIV. And yeast infections, I get that. You know, women, we get yeast infections for sure. We all have all kinds of fucking labia and shit going on, you know, like it happens. There's a lot of this that I don't understand the reasoning, because I'm like, it's called washing your ass. Like, you just wash your ass. Like, again, roughly speaking, 60% or like 2/3 of the population of the world of men are uncircumcised, and you know, are they just like buried in schmegma? No, they aren't. You know, they probably wash their ass, right? So, I've been confused about the rationale. It's been difficult for me to like understand what really, you know, are the whatever really are the reasons that could be, you know, the pros and cons here, the pros. So I wanted to do this video. I wanted to talk about it. I feel like it's a super important thing for men's well-being, and as a downstream effect of that, you know, like women's experience with men. And so I knew, like, I tried to kind of get my facts together, because like I'm saying, like, for me, it wasn't that hard to sell me on it, right? I was already sold on it, and then I was like honestly shocked that circumcision was even a thing. So I try to kind of like get my facts together, right? So I can, you know, do a good job here of capturing what seems to be the kind of like history of circumcision. And it was a little bit tough because, first of all, it turns out it's just kind of like a bottomless pit of a cesspool of fucking super disturbing things, that every single thing you learn is like worse than the thing that you learned before. And second of all, just like I said, coming on the heels of what's been happening with trans agenda in the US. And just to be clear, I do want to make this point that, like, I don't give a fuck what anybody does with their body surgically or in any other way, like after they're 18 and you're an adult. I don't think that employers should be like forced to like hire some percentage of you or anything. Like, fucking, you want to put horns in your skull, or like do drip on your teeth or whatever that is, like grills and like diamonds and stuff, or like cover your face in tattoos. I have tattoos, like not on my face, you know, or alter or modify your body or your genitals, or have cosmetic surgery, or have hormonal treatments, or make yourself look like the other gender. Like, literally whatever the fuck you want to do. I'm more of like a libertarian in that way. You know, I'm not a Christian. I will talk about Christ here in a bit, because it turns out that comes up and is pretty important. But like, you're 18 plus, fuck it, just do it, you know, and then suffer the consequences of however wild and radical that might be. Don't care. That's fine. That's freedom. America's about freedom. You're 18, you're not hurting anybody, just do it. That's fine. So I'm not like against the trans agenda or any agenda relative to that. What I'm against is like interfering irreversibly with children. And this is we're interfering irreversibly with male baby boys to a dominant degree here. So, okay, it seems as if in the United States, the prevalence of routine male circumcision, it was up to like 90%, but it's kind of declining now, and it might be like in the 50s or 60s now. I can't really weigh in on that right now, but in Islam, okay, there's another point I gotta make, but in Islam, it's like between 90 and 100%. So, and they procreate a lot, so a large proportion of the men on this earth that are circumcised are Muslim, just by sheer dint of like how many there are, and the fact that that's like very, very prevalent in their culture. Okay. Judaism, there's like something like a 99%, not 100%, but like a 99% adherence to circumcision, routine male circumcision, because that's kind of their whole deal. And like the Abrahamic faiths, apparently Abraham came down from the mountain. He was like, hey, God said, fucking cut off your foreskin. Everybody was like, oh, okay, my bad. Like, I mean, it's a little bit tough for me to believe that anybody would go along with that. It's possible that that was sort of a story that was put upon a cultural tradition that was already happening there or something. I don't know. I wasn't there. In Hinduism, the Indian continent, apparently like very, very low. In like Shinto and just Chinese people generally, like it's, I guess, more sort of cultural depending on where they live. With Christianity, basically, it's like Jesus was not, okay, there was the Abraham thing that, Islam, Judaism, and the Old Testament of Christianity have that root in common. Those are called the Abrahamic faiths, and Abraham was the one that said we all got to cut off our foreskins. I feel that that's really fairly insignificant, because I don't know anybody in my life that has chosen to circumcise their child or was themselves circumcised when they were several days old because anybody was invoking Abraham. Like, that's what we have going on as a narrative about hygiene, here in the US, okay? But I'm just saying, let me just finish making this point, that you can kind of run it down by the major faith traditions in the world in terms of whether that was like advocated for or not, with some breakouts depending on like cultural and where those people end up living. Stats on this are a little bit tough because I feel like every source that I check, it kind of keeps changing, and I feel like this is probably because there's been this weaponized immigration that's been going on, specifically involving Muslim people from Muslim countries, which, like I said, have like a 90 to 100% rate apparently of circumcision adherence. That I hear all up in Canada, all up in Ireland, all up in the UK. So then what were previously kind of the statistics for circumcision adherence in those countries is like all fucked up now because of that. But like Russia is kind of a good example. Like typically the European, like white European countries weren't so much doing this, okay? So I think Russia is still like sub 15% circumcised, and France used to be like sub 14%, but then, like I said, there's just been this weaponized immigration going on. So it completely skews the statistics, but there's lots and lots of people functioning where this isn't a thing. Okay. A few notes about Jesus, and then I do want to talk about Victorian era quackery. All right. So I'm not a Christian. I wasn't raised going to church or like in a faith tradition or anything like that. The more I learn about Jesus Christ, the more based as fuck that dude sounds, and I'm pretty on board with what he said. I would definitely ascribe my reluctance to participate in religion to several factors. One of those being just simply an introvert, where that just sounds like a lot. I don't really want to like go like hang out with a group of people about that thing, you know? Like one of the things that Jesus said was that we don't need an intermediary between us and the living God, you know? Like you can do that yourself. And I'm like, yeah, I agree. Another thing that Jesus said was that like we should not stand for usury, like flip the tables, right, on the moneylenders. Pretty based, right? Jesus, so New Testament on, you know, was not an advocate for routine male circumcision, not at all. He didn't want to create any kind of impression like people can't come to the church or come to the faith or come to the Lord, you know, if they were circumcised. It's like, he was all about like, it's what's in your heart. It's not, you can't like do stuff to your physical body and make these sort of surface level alterations that's going to, like, he doesn't fall for that shit. Like, God's not dumb, you know, like it's what's in your heart. You know, that's what Jesus said. So I think at one point he was criticized for healing somebody on a Sunday by the Jewish faith or whatever. And he was like, well, you guys are like cutting off babies' foreskins on a Sunday. So can I not heal a bro? And like, right. You know, so Jesus, the more I learn about Jesus, the more I'm just like, wow, like what a guy. Does this cause me to be a practicing Christian? No, it does not. I comment on this, you know, kind of from an objective point of view. What I'm mostly confused about, and this is tough to research because, you know how things are now. You can only research certain things and get straight answers. So if somebody could just like jump in the comments and like explain this shit to me, I literally do not understand this. Like the whole time I've been growing up, the phrase Judeo-Christianity was just the phrase. And I never even questioned it. I never even had a critical thought process about this, like whatsoever. Nor was I a practicing Christian. You know, so it was just kind of like, that's over there. I don't know, Judeo-Christianity. It's Judeo-Christianity, you know? And it's only kind of recently that I've been like, wait, what the fuck is that about? Because Jesus he flipped the tables on the moneylenders. You know, you'll get deplatformed or things will happen to you or your pager will blow up, some shit, you know, if you say that like the Jews killed Jesus. I wasn't there, but apparently that's what happened. They didn't just kill him, they tortured him to death. Okay, so the assassination of the Messiah of the Christian faith, who himself defined what Christianity really is like post-New Testament, you know, because I've read many, like I dropped out of seminary, I've read many excerpts of the Old Testament, and it's like, that's like Game of Thrones, it's like fucking horrifying, right? Which is why that's tied in with Islam and Judaism. So the fact that we just, all of my life, we refer to Christianity as Judeo-Christianity, it's come to me late in life that this confuses me, because it almost seems like if you met a widow, okay, and her husband was murdered, and she has like a hyphenated last name, and you'd be like, oh, is that your last name plus your departed husband's last name? And she's like, oh no, that's my departed husband's last name plus the name of the cartel or something who killed him. You'd be like, that's what I'm saying. Please explain this to me in the comments, because I do not understand. Like, it seems to me, the more I learn, that Judaism and Christianity are like mutually exclusive, as are many faiths. Like like these faiths, they're not fucking about each other. It's like you gotta join one club or the other. And I'm just over here introvert style, like I don't want to fucking put clothes on a Sunday. But Judeo-Christianity, like, why would that be hyphenated? Why would that be a thing? So there's a 99% uptake level on routine male circumcision over in Judeo, and then for what Christ actually said, as far as I can tell, he was like, no. I mean, you're not like, you can still come to the faith if you're circumcised. That's not a fucking problem. But like, you don't need to do that stuff. You can have your own relationship with no intermediary and no like weird surgical interventions, because God's not like tricked like that. Okay, so that's a thing. That's a thing. But now what I have to move into, and this was maybe the most interesting for me because, like I said, I was trying to go on a fact gathering mission for you guys so that I could not do a completely terrible job with this video, is that for us culturally here in the United States, Victorian medical quackery seems to have informed a lot more of like what we still unconsciously subscribe to this day relative to routine male circumcision. And so if you will recall, the Victorians were, you will remember such bangers as frontal lobotomy, you know, as a cure for depression, anxiety, just being kind of weird, you know, just kind of literally anything, just like drill a hole in the brain until they aren't that way anymore, which we now recognize as being an atrocity. But at the same time, now we chemically lobotomize people. So it's not that we completely rejected the idea of frontal lobotomy. It's just that we found like a more sort of PC way to do that. Okay, Victorians also, this was like a hotbed of just like crazy shit medically. That hysteria was because of the womb like migrating around in a woman's body, and that like that's why we're insane. To the extent that we're insane, there's all kinds of fucking ways to talk about that, but like that's not it. You know, I've had a like womb all my life and it like stays put, you know. But like some of the recommended medical interventions for this were to like go in and like dildo therapy or like finger banging. Like I'm gonna go in for my like finger blasting appointment now because of my like wandering uterus making me crazy. Okay, you know. They recommended drinking all kinds of like mercury. Drinking mercury was like a cure for stuff like radioactive tonics. So these people were like not reliable protagonists medically, and I'm not standing on some kind of high horse and being like, oh, we got it all figured out now. They were crazy, but we like I'm old enough to remember what they've done to us, what they tried to do to all of us. So everything's super crazy now, and you better watch your own six. Like that's all you can do. But I cannot possibly recommend Victorian social control, thinly disguised as medical interventions, as some kind of like reason to conduct any kind of certainly irreversible medical procedure on a person. So it's really the Victorians that were heavily promoting the idea of circumcision, routine male circumcision, as a way to prevent masturbation. They were very much like anti-masturbation. Okay, so I came upon a little like timeline of the sorts of justifications that have been used to perpetuate male circumcision starting in 1830. So cures wet dreams, stops masturbation, cures spinal paralysis, cures epilepsy, cures bedwetting. Let's see, after 1870, Dr. Louis Sayre claims foreskin causes paralysis of bladder and curvature of the spine. Let's see, moving into after 1890, mass circumcision implemented across the United States, cures blindness, deafness, and mental retardation. Wow, pretty sure retards can still jack off. John Kellogg promotes circumcision as punishment for masturbation. That was in the 1890s-ish. Circumcision will prevent blacks from raping whites. Circumcision, this is more like 1950. Okay, cures tuberculosis. Compulsory circumcision of American boys begins. Prevents penile cancer, prevents mental illness, prevents venereal disease and cancer of the tongue, prevents urinary tract infections, and prevents AIDS. Okay, so apparently circumcision is just like, wow, cures everything. We didn't cure any of those things, but we started circumcising everybody. This is a psyop. And the fact that everybody gets so triggered even talking about it is a psyop. And to an extent, I understand, like, because, you know, if you had an irreversible medical procedure done to you when you were literally only days old, and you had your fucking chubby little hands like strapped down, and you were given minimal anesthesia, and something was done to you that can never be undone, then it would be pretty shitty to hear anybody kind of like speak against that in a sense, you know. And I've like had this discussion with like partners and like people in my life where they're like, let's just not like, what are you saying? I'm a fucked up. And it's like, this is generational trauma. You know what I mean? Like, we need to think about this, and we need to talk about it. And it doesn't make anybody, like not like functional and completely satisfying in the bedroom department, but like, this is horrifying. It's like horrifying, the level of trauma, somatic trauma that little baby boys have experienced as a result of all of us just not wanting to think about this or talk about this, with this kind of, you know, I think that for us culturally now in the United States, like the whole like anti-masturbation campaign, which was huge from the Victorians, which is a little bit weird because for the wandering uterus insanity thing for women, you got to go into the doctor and get finger blasted, you know. But for men, let's just like do an irreversible medical procedure and like get like cut off part of their dick that's totally supposed to be there, and then that's anti-masturbation. So it's like, it's difficult to say. It's difficult to say. Is this like sex positive or sex negative? Definitely sex negative for males. Very sex negative for males. Are we sex positive or sex negative for males now? That's a good question. That's a really good question. I guess I would have to say that we're sex negative for males right now and sex positive for females. That'd be like an interesting different discussion. But okay, so then I was also researching a little bit on X, formerly Twitter. I follow a couple groups on there that are like specifically speaking out against routine male circumcision, comprised of individuals that are like, this is, you know, like I got circumcised, not happy. You know, I mean, the absolute like adverse, like, oh God, the surgery got all fucked up, like those kinds of like side effects are fairly minimal. I mean, if it's your baby that happened to, then it doesn't matter. But I mean, I think it's only like 100 infants per year that die in the US as a result of complications of a circumcision gone wrong, which is horrifying. But statistically, that's not huge, you know? I mean, the progenitor and the founder of sort of modern like gender theory, Dr. Money, is that how you say it? It's spelled like money, but it's like Dr. John Money, and he died in 2008. Like, this wasn't like a bazillion years ago. Like, this was like actually somewhat fairly recently, you know? He did a lot of his research and studies on these two twins. They were twin boys that were born. And the circumcision was botched on one of them to such an extent that they just like transitioned that little boy to a little girl, and then went on to like fuck with these two little kids in all kinds of ways, to the point that the one that was transitioned committed suicide at like 14 or 15 or something, and the one that hadn't been transitioned died of a drug overdose. You know, this is like horrifying. That was the founder of modern gender studies, Dr. Money, I think it's pronounced. Anyway, so I went on X or Twitter, my groups that I follow there, and apparently everybody just knows that it's Dr. John Harvey Kellogg was, you know, for us here in the United States, we're kind of like justifying all of this with like hygiene type stuff, you know. But here's what I learned about that. John Harvey Kellogg, the Battle Creek sanitarian physician behind cornflakes, viewed masturbation as a gateway to moral and physical ruin. He advocated routine circumcision, listen to me right now, ideally without anesthetic, for boys to create painful associations, curbing self-stimulation, embedding it in his health reform crusade against vice. This Victorian era push, amplified by hygiene claims from surgeons like Louis Sayre, normalized the procedure in US hospitals by the early 1900s, peaking at 90% newborn rates mid-century before declining amid autonomy debates. Okay, so he advocated routine circumcision, ideally without anesthetic. Let's just fucking sit with that for a second. So this is a pre-punishment. This is like when we learn about torture in the dark ages, the medieval days, because it was the whole, it was a feature, not a bug. You don't just execute people. This is like the, Catholic Church or whatever doing this kind of shit. Like, you got to torture people and make them suffer to purify and cleanse their soul. This is what Jesus fucking spoke against. He rejected this. Okay, but you gotta make people suffer in order to cleanse them spiritually. So this is what we got here with this guy, John Harvey Kellogg. He's saying, ideally, circumcise boys without anesthetic. And to this day, I mean, because they circumcise. Okay, so first of all, this is like a hospital add-on. They can just add it to the bill, so it pads the bill for parents who've delivered a baby. Okay, so there's that. Second of all, they're going to do this within several days of birth, because the baby like too strong, you're gonna like strap their little chubby hands back so that they can't do anything. Minimal, I think they use lidocaine most commonly these days. Like, you can't gork out a newborn baby. That's you can't put them on some like heavy duty, analgesia. Like, so it's like local topical like lidocaine type stuff. And so parents, and I know, I'm friends with parents who, even recently done this. So they're like, yeah, this should be pretty painless. That's a thing, right? So okay. So that's the compensation that we made. That the recommendation from bro here, John Harvey Kellogg, was without anesthesia in order to pre-punish the male for his sexual proclivities, to traumatize you right from the ground up, I mean, it would be the same thing removing the hood from the clitoris. If you remove the protective sheath from the male penis, which in itself, the protective sheath, the foreskin, contains gazillions, 20,000 nerve endings. It's an entire, erotic, sensual apparatus in its own right that also is like helpful for the woman. Then you get a desensitization, relative to what's left. Okay. So I liken this is the analogy that I would make. Like, when you go to the gas station, you're on a road trip, and I travel constantly for like work and for everything else. So like you get a snack and you're driving and you're eating your snack, and it's like, they do this on purpose. It just doesn't quite have enough like salt or MSG or something. It's like, it's got enough stuff to like completely coat your hands, and it's all messy, but it's like, you just keep eating more and more and more and more, because it's just not quite enough. Like, every single bite is just not quite enough, and they do that. Like, I think that's what essentially this does for men, because it takes like, this area, just like the clitoris in women, it should remain super, super sensitized, because normally, with the exception of like massive sexual arousal, it should be protected, from abrasion, any temperature, any kind of things, with that protective lubrication that the male's body should supply. Cut all that off. Okay. So what position, and to say nothing of the trauma and the pre-punishment, whether there was lidocaine involved or not, the pre-punishment of being a male with the equipment to have libido, when he gets older. I feel like it would have that same effect of, and it does, of still remaining sensitive. Obviously, like, males' dicks are like very, very sensitive, and can experience arousal, but it takes more. Do you know what I'm saying? It's like that gas station snack that you have to keep eating more of, because you're like, I want a little bit more salt, so that results, plus there's like the loss of lubrication now. So this has to be, supplied from externally one way or the other. We all love rough sex. Okay. I'm not like speaking against rough sex, but like, to the extent that requires a degree of stimulation that can be like hard on women, you know what I mean? Because of the desensitization, that's hard to say. That's a result of all this, So I'll just say that I regret that I regret this occurring for most of the men in my life. Most of the men in my life. They don't remember it, you know, and they're fine, and they're doing their thing. You know, it's not gonna like derail your whole life sexually or anything like that. And to the extent that it's fine, you know, we just kind of keep doing that, you know, generation after generation. Like I said, it's generational trauma. You don't look like your dad, you know. And I regret the impact this has on mothers, you know. I mean, imagine you just went through that childbirth, and they're gonna take your baby out of the room and like do a quick thing, you know. Baby comes back and is pale, is blazed out, has an obviously strained expression on his face. The photos, the before and after photos, you know, and I've seen these because I follow these channels, you know, the before and after photos of infant baby boys, before and after circumcision, break my fucking heart. And I don't know in every single one what kind of level of anesthetic was used. I do know that if they left it for men to be like, when you turn 18, this can be an elective procedure. And, you know, less possibility of a yeast infection, less possibility of contracting HIV, which I wouldn't trust that shit whatsoever, coming from, you know, the country with the highest rate of, you know, I'm talking about Judaism right now, Israel, like the country with like the highest rate in the entire world of homosexuality, and where pedophiles that misbehave in the United States are like given safe harbor there, you know. And we got Anthony Fauci, who already was like super involved in the 80s in whatever was going on with AIDS and HIV. And then he was like Mr. COVID guy. People were getting tattoos about him. I got my Fauci ouchie, you know. And like it turns out, as a part of the COVID vaccine, that they like, like COVID vaccine is like HIV, and people coming down with VAIDS. It's called VAIDS. You know what I mean? Like, so when the people with, you know, a 99% adoption rate for like routine male circumcision, or like, this is the thing that spinal paralysis, whatever, bedwetting, blacks raping, whatever, all of that too, sure, cures retardation, something like that. Also prevents the uptake of HIV. I'm like, get out of here with that. That's not a data point. Okay. Yeast infection, that's probably a data point. Wash your ass. Wash your ass. You got running water? Wash your ass. You don't got running water? I grew up without running water. Many iterations of my life with my transient family in the oil field. Guess what? We still washed our asses. You know, it's not that hard. Where there's a will, there's a way, you guys. Like, so if you gave boys the option to turn 18 when they're a legal adult, and to, here's the pros, here's the cons, you know, you want to go receive some anesthesia, get this procedure done, just let them do it. That's bodily autonomy right there. That's fine. Okay. How many of them are going to do it? Probably none. So that's why you got to get them when they're babies. That's why you got to have a whole fucking psyop about it. You know, I know men who, for all kinds of very aligned reasons, it was just the time in their life. They already had their kids, you know, stuff like that. They're like interested in a vasectomy. They're super nervous about it. And it's not even to the extent of like going and having like your entire foreskin chopped off, but they're super, super nervous about it. So how do you think a baby who just got born feels? I used to work in critical care in the hospital for about 5 years. I was a respiratory therapist, okay? I was trained by the military. It wasn't like a super aligned career for me, but like I worked around lots of people that were on ventilators, and they were like gorked out of their minds. They were completely immobile, completely unconscious. You know, like I'm talking people with like real bad stuff going on. Guess what men do? Guess what those male patients do? They shouldn't even be able to move. they're so medicated that they should not even be able to move. And they will like drift their arms over and they will like cover their genitals. And I used to kind of think that was like funny. But then when I really thought about it, because women don't do that, I was like, I wonder if that's because the last time they were in the hospital and they were all gorked out and they just got born, somebody came and cut off part of their dick, you know? It's like, we used to do like open heart surgery and stuff on infants up until like the 60s, I think, without anesthesia, because we thought that if they couldn't talk, then they couldn't feel pain. This makes me crazy. It makes me crazy. Like, what have we been doing to babies? What are we still doing to babies? And even to the extent that they got a lidocaine injection before their thing. And I tried to watch, as part of my research, it was like a computer simulation of exactly how circumcision works. And I like literally, I couldn't watch it. It's so fucking gross. I couldn't watch it. And as somebody who's been an appreciator of men who have intact foreskins, I don't understand. I just don't understand why, right? So, can infants experience pain? I think they fucking can, you know? So there's men who've been traumatized in ways that they don't even remember and had parts of their experiential setup removed in ways that they'll never experience and they'll never get back. And that might become like anti-routine male circumcision warriors, or they might become like my, I don't really call him my ex-boyfriend, my dead boyfriend. He was really, really challenged and triggered when I talked about this, because he just felt very triggered by it. Who were like, hey, just shut up about that. You know, like, what are you saying? I'm all messed up. And I was like, no, like, love it. It's great. Pegasus, or no, he wasn't a Pegasus. He was a Clydesdale, you know, but like, I don't, to the extent that we don't really kind of culturally know how to treat like trauma that happens to us and extreme physical suffering, like before we're verbal, you know, because this is occurring before boys are verbal. Like, patients in the hospital, they're like gorked out, but they're still covering their genitals. Like, what is it that we still carry with us? And how deeply does that affect us? You know, and how deeply does that possibly shut us down from the kinds of like bonding that could occur with female partners otherwise? I don't know. Yeah. So all in all, I'm against it. I'm against routine male circumcision, and I'm not even gonna do the thing where I say, except for, you know, specific religious reasons, because, you know, just switch it out with clitoridectomy. Anybody watching this, are you on, and this is happening too in the US, you know, there's people coming here from Somalia and clitoridectomying their daughters, you know. I think that the United States should stand for bodily autonomy, among many other things. First Amendment, Second Amendment, all kinds of things. I think if the trans agenda has taught us anything, it's that we need to deeply and urgently question the irreversible medical procedures that we're conducting on minors. And ground zero for that, in terms of the prevalence and the number of people that are being affected, is routine male circumcision. Yeah. I welcome your comments. I hope I've done a good job of conveying my thoughts and the degree of information that I have. Again, like I said, it's kind of bottomless. I just really touched on some super brief things. I'm also, okay, I just got to throw this in. I haven't seen this nobody's saying this, but like, separately, sort of, I've been like, what's going on with Tartaria? If this isn't something that's on your radar, then just disregard. But like, what's going on with Tartaria? Like, there were these world fairs, you know, where we had these, like, all over the world, there was like incredible architecture and buildings and structures and monuments. And then supposedly they were all just torn. It was all for just a world fair and they all got torn down. And like all of this stuff is like greater than any city that exists ever, like on the face of the earth, right? And then we have all these like weird, they're like beautiful, gorgeous, ornamented, amazing, mind-blowing mansions that were turned into like sanitariums, and that we sent the crazy people, but that are also in some cases like government buildings or post offices, and there's been this like big spike in like gorgeous, amazing architecture. We don't even know how people did that, and then this big decline where we have like shitty looking buildings like the DMV and stuff like we have now. And then there's this weird thing about the Cabbage Patch Kids, which that was I was there in the 80s. I remember all that going on. But there were like postcards with art of like fields of like babies in cabbages that was like adopt one now, and all kinds of like things that it like all points to sort of the Tartarian mansions had like fireplaces that didn't have a flue. They didn't go up. It like had some kind of like antenna thing, talking about the ether. Now we're talking about like Tesla 369, the ether, already solved energy. And then it just seems like there was some kind of like hard reset, and like what was done to all those people that knew this? Is it Atlantis? I don't know. There was some kind of like hard reset that happened to get us from what seemed like a pretty like golden-ish age to where we've been. That maybe did it involve frontal lobotomies? Maybe did it involve Victorian medical quackery? Maybe did it involve the incarceration of all the people who wouldn't go along with the program into sanitariums where they were lobotomized or God knows whatever? Maybe did it involve rollout of a huge routine male circumcision campaign to like, undermine, because for men, like John Harvey Kellogg, keep forgetting his like stupid fucking name, advocated routine circumcision without anesthetic, specifically to like punishment, like to be like, be this thing but don't, do this thing but don't, have this thing but don't. So you're just pitted against yourself as a man. And then all of those, all the effects for society downstream, because men are the ones who advance the project of civilization and protect women and children, I'm just a little bit curious about the connections between Victorian quackery generally and like Tartaria, which that remains outstanding for me. So I can't say that I have something substantive to offer to you, but that's just like a last thought here. I haven't seen anyone else kind of like make that connection, but it seems like a great way to it seems like in line with the kind of program that was going on, to disempower. Yeah. So yeah, I don't like it. If you made it to this point in the video, I'm really grateful for you coming along with me. I think we should talk about it. I think we should think about it. I think we should walk ourselves a foot back out of it. I think we should acknowledge the ways that a foreskin is like a healthy and functional thing for men and for women who are dealing with men. And I appreciate, in advance any of the thoughts and comments that you want to share with me.